Hi and welcome. My name is Lisa Cooper, and I'm a registered dietitian here at Orlando Health Center for Health Improvement. And today we're going to talk about intermittent fasting. And may have questions about it. What is intermittent fasting? Pretty popular in the news. A lot of people are doing it. We want to find out, is it really work? Is it helpful to us, or is it harmful to our health? So with that, let's go ahead and get started. Let's start with the definition of fasting in general. It's basically to abstain from some kinds of food or drink, or all, especially as a religious observance. And that's pretty vague, some kinds of foods. And what I found with intermittent fasting, the definition of it is just as vague. So with intermittent fasting, it says it's a complete or partial restriction of your calories for 1 to 3 days a week. And one example of that given is alternate day fasting, where you're not eating on one day, but you're eating regularly on the next. So back and forth throughout the week. Again, pretty vague, not saying hours, times, what kind of foods to eat. In addition, there's other types of fasting. There's complete or partial calorie restriction for like a defined period during your day. So they call that time restricted fasting. And you may have experienced that or are familiar with it from a religious standpoint, where people are eating only during specific hours of the day. But really, intermittent fasting has been in the news, promoted for weight loss and longevity, improved brain function and cognition and clarity, and decreased risk of chronic disease. So today we're really going to get into that and find out how much of this is true and how can it apply to you. Well, there is a lot of research in animal studies. They've been looking at fasting for years, and it's good research. They're saying there is a lot of positives out of it. You can improve your lifespan, cognition is enhanced, physical functioning is better, overall metabolic profiles are improved. So this sounds like a good deal for humans. The problem is we have relatively small, short studies on humans, so we don't have the full picture. So not every group has been studied either. So if you are an athlete, it may work for you one way, but it may not apply the same way to your body if you're a postmenopausal woman. So we are still in the trenches looking at research, but we'll share today some of the things that are available. And I'd like to just start with defining 3 types of fasting that are in the literature. The first is called alternate day fasting. There's also modified fasting and time restricted. With the alternate day fasting, it's just that. Every other day, you're going to switch fasting versus eating. So your eating days, you're going to eat what you typically would on a normal day. And I put healthy in there because that's one of the things that I'm going to encourage if you are trying this as a nutrition plan, that you are eating from a healthy plan to begin with, because it may not work otherwise. And then the fasting days, you have little or no food. And it's anywhere from no food to about 25% of your calories. And they do include calorie-free beverages like coffee, unsweetened tea, and basically water. So I'm like, what does 25% of calories look like? So I put it together in a little menu plan, just to give you an idea of how much you'd be eating on those fasting days, if at all. So 500 calories, and I base it on a 2,000 calorie diet. So 25% of that is about the 500 calorie mark. That is equivalent to 2 pieces of hearty whole grain bread or toast, like Ezekiel bread, and an avocado that you've split in half and put on each piece of bread. So 2 pieces of avocado toast. That would be 500. Or you could have maybe a bean soup, about 1.5 cups of bean soup, so a bowl bean soup with 6 to 8 whole grain crackers and a large apple. And that is pretty close to 500 calories. So as you can see, that 25% of your needs is not a lot. It's a small amount of food to have on those fasting days. And with this alternate day fast, there are pros and cons. For each of the fasting, there's pros and cons, but the pros for this is that they have compared alternate day fasting to people just following a reduced calorie diet, and they had similar outcomes. So it is as effective as following a reduced calorie diet on a daily basis. So that's a good thing. And they found during the study that the reason the weight loss was successful is the people, even on their normal eating days, they only ate 95% of what they really needed. So they still had a calorie deficit, which helped with reducing calories throughout the week and contributed to that weight loss. But some of the downsides are you will be hungry. You're going to feel possibly lightheaded and a little crabby, have trouble concentrating, maybe irritable. So that would be one of the things taken into consideration. If you don't like to be hangry, this would not be the method for you to use. Another problem is if you don't restrict your calories enough on your non-fasting days, so your regular eating days, it might interrupt your ability to lose weight successfully. And we really, really don't know for any of these fasting methods what the long-term health effects are, because all the studies have been so short. So that is something to keep in mind. And with the alternate day fasting and modified fasting, you would not want to do these long-term anyway. From a health perspective, it wouldn't be beneficial for you. So this would be a temporary eating adjustment. And the other piece that they've shown in the literature is people really did have difficulty sticking with this alternate day fasting. So it's a more difficult plan to have. The next one I want to talk about is modified fasting. So it's instead of alternate day every other day, you're going to have longer days of non-fasting. So on your non-fasting day, on your fasting days, it's 20 to 25% of your calories, about 500, just like I showed you before. And then normal eating on your non-fasting days, but you're going to do the fasting less often. So 5-2 is what's very popular in the literature. So you're eating for 5 days, and 2 days you would do your 25% of calories or your fast days. So like Tuesday, Thursday, as an example, would be your fasting days. And people are able to stick with this one a little better than the alternate day fast. So some of the pros with this, easier to follow even than a calorie restricted diet. So if you're someone who doesn't like to calorie count, this might be a plan to try. Some research, and it goes back and forth with this one, does show weight loss, but I think it probably depends on how restricted your calories are on your non-fasting days. Or if you restrict them too much, it could also make it difficult for you to continue to lose weight. So this research goes back and forth on that. And as I mentioned earlier, these have good adherence, so people are able to stick with it a little bit better. But some of the downside is we don't know if it'll work for your weight loss. We're still researching it. And definitely you're hungry on this one too. The hunger scales are higher compared to a low calorie diet. However, some people do adapt and it gets better over time. So it just depends. And that's an individual outcome. The third type of fasting I wanted to talk about is time restricted. And this is maybe the one you're most familiar with. It's basically eating during a 12-hour window or shorter and a fast overnight. So like a 12-hour fast. And some of them have been even shorter in the fasting range. So we've seen this in religious practices. So like Ramadan, where they're fasting during the day and they eat at night, just a few small meals. And they have had results showing that people lose some weight during Ramadan. Unfortunately, when they go back to their normal eating, the weight does come back. Latter-day Saints are another one where 2 meals, 1 Sunday per month that they fast on. This type of fasting also could be like a 16-8 window. So you're eating 8 hours a day and fasting for 16. So an example is like from 8 to 4 or from 12 to 8. They have pros and cons with this one too. The pros is that, again, you don't have to count calories, and it may help promote weight loss. Again, it's inconsistent in the results. Metabolically, they found that it's better for you. It can help lower triglycerides, glucose, LDL, blood pressure. They find that when you do a longer fast overnight, that is really the key for these metabolic improvements. And when they did the 8-2 study, the 18-hour fast, people actually had their hunger limited and had increased fat burning. We still don't know long-term effectiveness. And there's always the possibility with any of these fasting plans that you're not getting all the nutrition you need. Out of all 3 plans, if you were going to do this as a lifestyle, this would be the best one to choose. And I've had people ask me, what time of day would be the best to fast? And really, it's not defined again in this literature, but there's research to show that eating earlier in the day is better because your metabolism is functioning at its optimal level. So you're going to make the most out of calorie consumption. And the American Heart Association had a position paper that said eating early in the day is better than later in the evening because it improves your metabolic risk factors. So for those reasons, I would recommend it being earlier in the day. So we have seen some positive impacts on risk factors for disease, like lowering your lipids, like triglycerides, blood pressure, LDL, increasing your good cholesterol, that's the HDL. But we don't know if these are long-term fixes or if it's just a short-term response to the fasting regime. They did a few studies on diabetics, and they used a low carb and they used the 5-2 fasting method. And with that, they saw improvements in insulin sensitivity. But the downside is they found that when diabetics are eating just one meal a day, it is actually worse for morning glucose. So this might not be the best combination for a diabetic. And also pre-diabetes, they did a study on people with pre-diabetes, and they found that the alternate day fast helped with reducing body weight, body fat, and insulin resistance. So there are some positives, just like they saw in the animal studies, but we just don't know what those look like long term. So here's some considerations if you're thinking about fasting. You definitely want to look at your current health status. It's really not recommended if you have type 1 or type 2 diabetes, if you're taking insulin or diabetic medication, or if you're on a specialized diet for a disease state like kidney disease or renal disease. If you're hypoglycemic, so if you have low blood sugars, this would not be the appropriate for you. Or if you have to take medicine with food, again, this wouldn't quite be the best option for you. And then if there's anybody who's pregnant, breastfeeding, adolescents, children, anybody going through growth in their body, would not be appropriate for the fasting regimes. And then again, if you already have a disordered eating or eating disorder, we wouldn't recommend that. Some of the side effects you would experience are things like hunger, fatigue, headache, may feel hot or cold, feel low energy and irritable. And when you're doing alternate day fasts, because you're not eating on those days, you may feel gassy or bloated. Another risk for any of the fasting is that you might have some nutrient deficiencies. I mean, as Americans, we already have difficulty getting in some of our nutrients. Calcium is an example. So cutting more foods out of the diet may make that more likely. So who would be a good candidate? Well, somebody who can tolerate long periods of time with no food. So if you feel like you could do that, it would work. Trouble with calorie counting, so you don't like to count calories or tracking is not for you, then maybe this might be a better option. And if you don't have one of the medical conditions we just talked about that may interfere with a fasting regime. Availability of food. You have to be someone who can be around food but not be tempted by it. So that might be something to take into consideration. And what is your current eating pattern like? Maybe the time restricted won't work for you because every night at 8 o'clock, you have to wait till then when everybody's home to make dinner. So really you have to see how it fits into your current lifestyle too. You have to make sure that you're meeting all your nutrient needs. And so it's recommended that you are monitored by your health professional or a dietitian to make sure that your plan is well-rounded. So the bottom line, more research is needed. This is just introductory. It looks like it might be a good thing. We just need to know more about who it's best for, how to do it, because the definitions are all over the place, best times for it, etc. Again, not recommended for people with chronic disease like diabetes, heart disease, kidney disease. If you're pregnant, breastfeeding, or eating disorders, it may have some positive effect on eating hormones. So we're looking at that too. We know that it promotes some short-term weight loss, but we don't know about long-term. And also long-term health effects. We still don't know what that looks like. So research is ongoing right now. There's one that they're looking at, and they've extended to a year to see how people do with it. Most of the studies are on animals, so we really need to continue to do the research on humans. And just so you know, this is not currently a recommended weight loss treatment for weight loss or any other health condition. This is more moving from fad to research before we could make a recommendation on it. So I put it together a slide on, what if you wanted to try it? This is something you're interested in. Maybe it'll help me with my current weight loss plan. And most of the research has been with a weight loss in mind, so they know that it is working. And I would recommend trying the time-restricted eating first, because it's not going to hurt to not eat for 12 hours unless you are on a special diet prescribed. So you want to be following a healthy eating pattern to begin with. So from that, I mean lean proteins like fish and chicken, plant-based proteins, beans, peas, lentils, nuts and seeds, lots of fruits and vegetables, low-fat dairy, etc., and healthy fats. And then you set a time for yourself to start and stop eating. So maybe you start with that 12-hour window, 8 to 8, and test it out and see if you do well with it. And then maybe you can move it to 8 to 6 and tuck it in a little bit on the nighttime end and see if it works for you. Or maybe you decide you're going to try to shift it a little later because you're not a morning person, so you don't get up until 9. So maybe your window will be a little bit different depending on your personal lifestyle. Just from the notes earlier, eating earlier in the day may be a better option from a cardiometabolic standpoint. You want to make sure you're drinking plenty of fluids and choose high fiber foods that are filling you up to keep things moving through your body too. You want to take a multivitamin just in case to cover needs. Anybody on a weight loss program should be taking a multivitamin. And then I put down there, use a meal replacement, because some of the studies did include meal replacements, but that would be a personal choice and it would be an option to try. And most importantly, we want you to speak with your healthcare provider before taking this on. So I want to thank you very much for your time today. This is Lisa Cooper signing off from the Orlando Health Center for Health Improvement.